Today, we're diving into a crucial topic, the early signs and symptoms of HIV in men. We're going to cover 10 potential indicators that you should definitely be aware of. Early detection can make a significant difference, so stay tuned to learn more. Let's get started. Number 1, fever. It's something we've all experienced at some point in our lives. We've all been there, right? You feel warm, a little under the weather, maybe even a bit achy. Now, a fever by itself doesn't automatically mean you have HIV. It's important to understand that fevers can be caused by a variety of factors. It's your body's natural way of fighting off infections, whether it's a common cold, the flu, or something more serious. But here's the thing. One of the early signs of HIV can be a persistent low-grade fever that just won't quit. This isn't your typical fever that comes and goes. With HIV, the fever tends to be more subtle, often hovering around 100 to 101 degrees Fahrenheit. It can be easy to overlook. You might feel a bit warm but not necessarily sick enough to be bedridden. This can make it tricky to identify. This fever is caused by your immune system working overtime to fight off the virus. Your body is in a constant state of alert. It's like your body is sending up a flare saying, "Hey, something's going on here." It's a signal that shouldn't be ignored. If you have a persistent low-grade fever that lasts for more than a few days and you can't figure out why, especially if it's accompanied by some of the other symptoms we'll be talking about, that's when you need to see your doctor. Don't wait too long. Getting tested is the only way to know for sure, and early detection is key. The sooner you know, the sooner you can take action and manage your health effectively. Number 2, fatigue. We all feel tired sometimes, especially after a long day or a tough workout. But when we're talking about HIV, fatigue is different. It's not just about feeling a little sleepy, it's a deep, persistent exhaustion that can really impact your daily life. Imagine feeling like you just ran a marathon, even though you haven't even left the house. You might struggle to get out of bed in the morning, even after a full night's sleep. Everyday tasks that used to be easy suddenly feel exhausting. This intense fatigue is another sign that your immune system is working overtime to fight off the virus. If you're experiencing a level of fatigue that's unusual for you, that's preventing you from doing the things you normally enjoy. That's a red flag. Don't just try to push through it. Talk to your doctor. Number 3, swollen lymph nodes. Let's talk about your lymph nodes. Those small bean-shaped glands that are part of your immune system. These tiny structures play a crucial role in keeping you healthy. You have them all over your body, but you can often feel them in your neck, armpits, and groin. These are the areas where they are most prominent and can be easily noticed when they swell. Think of your lymph nodes as your body's security system. They act as sentinels, always on the lookout for potential threats. They contain cells that fight off infections. These cells, known as lymphocytes, are your body's first line of defense against harmful invaders. So when you get sick, it's normal for the lymph nodes near the infection to swell up a bit. This swelling is a sign that your body is working hard to fight off the illness. Now here's the thing about HIV. One of the early symptoms can be swollen lymph nodes, particularly in the neck, armpits, or groin. This is because the virus targets your immune system directly. These swollen lymph nodes might feel tender or even painful to the touch. The discomfort is a result of the immune system's heightened activity. This swelling happens because the virus is attacking your immune system, causing the lymph nodes to work overtime. They become inflamed as they try to filter out the virus. If you notice persistent swelling in your lymph nodes, especially if it's accompanied by other symptoms we've talked about, don't ignore it. Persistent swelling can be a sign of a more serious underlying condition. Get checked out by your doctor. It's always better to be safe and get a professional opinion. Early diagnosis and treatment are crucial. The sooner you address the issue, the better your chances of managing it effectively and maintaining your health. Number 4, skin rashes. Our skin is our largest organ and it can be a good indicator of what's going on inside our bodies. When it comes to HIV, a rash can be an early sign, often appearing within the first few weeks of infection. These rashes can vary in appearance. Some people might develop small red bumps, while others might experience larger areas of redness or discoloration. If you develop a rash that's unusual for you, especially if it's accompanied by other symptoms like fever, fatigue, or swollen lymph nodes, it's important to get it checked out by your doctor. Early detection is key when it comes to HIV. Number 5, night sweats. We all sweat when we sleep sometimes, especially if it's hot out or if we have too many blankets on. But night sweats associated with HIV are different. We're talking about drenching sweats that soak through your clothes and sheets, even if your bedroom is cool. These night sweats can be so severe that they disrupt your sleep, leaving you feeling exhausted during the day. If you're experiencing regular night sweats, especially if they're not related to something like a fever or a medication you're taking. It's important to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. Number 6. Muscle and joint pain. Let's talk about muscle and joint pain, a common issue that many people face. We've all experienced aches and pains, whether it's from a tough workout, sleeping in an awkward position, or just everyday wear and tear. These discomforts are usually temporary and manageable. But when it comes to HIV, muscle and joint pain can be an early symptom, often appearing within the first few weeks of infection. This type of pain is different and should not be ignored. This pain can range from mild to severe, and it can significantly impact your daily life. It can affect any part of your body, but it's often felt in the joints, like your knees, elbows, or shoulders. These areas can become particularly sensitive and painful. With HIV, the pain is often more widespread and persistent, making it harder to ignore or manage with simple remedies. If you're experiencing persistent muscle or joint pain that you can't explain, especially if it's accompanied by other symptoms like fever, fatigue, or swollen lymph nodes, it's important to get checked out by your doctor. These could be signs of something more serious. Don't just try to power through it. Ignoring these symptoms can lead to more severe health issues down the line. Early diagnosis and treatment are crucial. Addressing the pain early can help manage symptoms better and improve your quality of life. Always consult with a healthcare professional if you have concerns. Number 7. Sore throat. Alright guys, let's talk about sore throats. We've all been there, right? That scratchy, itchy, painful feeling in the back of your throat. It's usually a sign of a cold or the flu, and it typically goes away on its own within a few days. But when it comes to HIV, a sore throat can be an early symptom, often appearing within the first few weeks of infection. It can be more severe and persistent, lasting for weeks or even months. You might also experience difficulty swallowing, pain when you swallow, or a feeling of something being stuck in your throat. If you have a persistent sore throat that doesn't seem to be getting better, especially if it's accompanied by other symptoms like fever, fatigue, swollen lymph nodes, or a rash, it's important to get checked out by your doctor. Don't just assume it's a cold or allergies. Number 8. Headaches. When it comes to HIV, headaches can be an early symptom, often appearing within the first few weeks of infection. Headaches associated with HIV tend to be more intense and persistent. They might feel like a throbbing pain, a sharp stabbing sensation, or a feeling of pressure inside your head. If you're experiencing frequent or severe headaches that are unusual for you, especially if they're accompanied by other symptoms like fever, fatigue, swollen lymph nodes, or a rash, it's important to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. Number 9. Weight loss. Losing a few pounds is usually a good thing, especially if you've been trying to shed some extra weight. But when it comes to HIV, unexplained weight loss can be a concerning symptom, often occurring as the infection progresses. We're talking about significant, unintentional weight loss, losing 10% or more of your body weight without even trying. This weight loss can be accompanied by a loss of appetite, nausea, or diarrhea, making it difficult to keep food down and maintain a healthy weight. If you're losing weight without making any changes to your diet or exercise routine, and especially if it's accompanied by other symptoms like fever, fatigue, swollen lymph nodes, or persistent diarrhea, it's crucial to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. Number 10. Diarrhea. We've all experienced it at some point, those loose, watery stools that send you running to the bathroom. But when it comes to HIV, diarrhea can be a persistent and debilitating symptom, often occurring as the infection progresses. We're talking about chronic diarrhea that lasts for weeks or even months. It can be accompanied by abdominal cramps, bloating, nausea, and vomiting, making it difficult to stay hydrated and get the nutrients your body needs. If you have persistent diarrhea that doesn't seem to be getting better, especially if it's accompanied by other symptoms like fever, fatigue, weight loss, or abdominal pain, it's important to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. Thanks for watching. We've covered a lot of ground today, but remember, knowledge is power. The more you know about your body and the potential signs of HIV, the better equipped you are to take charge of your health. If you found this video helpful, please give it a thumbs up and share it with others. Don't forget to subscribe to our channel for more informative content on men's health, and as always, stay healthy and informed.